Question. When you say tech, what do you think of or refer to? What's up, everybody? I'm Tatyana.
And I'm Jackie.
And welcome to
What the Hell?
We'll never get over
that.
So, today's episode, we're going to be going over health tech.
I'm actually very excited about this one.
Very, very, very. Because technology and healthcare is definitely all in one.
Literally.
It's all connected.
All connected.
Yeah. Whether people want to accept it or not, it's here and it's here to stay.
Forever.
Literally.
Yeah. They don't have a choice really at this point in time.
No.
So to kind of like go based off of that first question.
Yeah.
What do we even count as tech?
Everything.
Literally.
Right? So like for me, any type of machinery that we use in the operating room. So like down to our bovie or electrocautery is what we call it. And it stops your bleeding. It stops your bleeding throughout surgery.
Yeah.
Any surgery that you have, you'll need that.
Okay, that would make sense.
Yeah. And then so for laboratory.
Oh yeah, everything is, the laboratory is tech. Whether technology, like the machines we use to run the samples, patient samples, they're $250,000 instruments.
Jeez.
Like, you don't want to break them because
that ain't coming out of my check.
Right. Definitely not mine. And then also down to like microscopes, our stainers, our even the interfaces we use technically is tech.
Yeah.
So the laboratory is all tech.
Yeah. You don't even think about, like, I didn't even think about microscopes.
Yeah.
That's definitely very
that is technology.
Techie.
Yeah. Literally, like, because before, like, the old school scopes were just kind of like you look down. Now we have ones that are connected to computers.
Yeah.
So you can have multiple people look at them at one time, or automatic, like, scanners. You just put it on there and the microscope will look for it and then display it on the screen.
Wow.
Yeah.
And I'm sure that streamlines your workflow.
So much.
Yeah.
Yeah. There's one specifically for, it makes a slide.
Okay.
So from the patient sample, it'll make a slide.
Okay.
It'll read the slide.
Oh, wow.
And then it'll tell you what cells are on the slide, and then you just have to go and confirm.
Wow.
Yeah. It cuts the amount of time in half, as long as it's been like trained properly.
Right.
Yeah.
Right. So that makes me think of how people are afraid that technology will take their jobs, because essentially what you're saying is the job that you used to do, which was having to read each slide, a computer system or the technology is able to read that, but you're still have to confirm it.
Still have to confirm it because we can't completely trust an instrument to read everything. And then even then there's some slides that are so like complex based off of like the person's condition. Right. You can't really trust the analyzer. If it's just like a majority of like normal slides, so there's nothing going on in there, yeah, sure. But I'm still confirming like, yeah, that looks good. Yeah, that looks good. But if it's something like, oh, this person like their hemoglobin is like 5 or like they have no platelets, I need to go see what's actually going on with that, because the instrument doesn't know.
So in that case, you're working alongside the systems and technologies, so you need to know how to troubleshoot it.
Exactly.
You need to know how to read it
completely.
So it's not necessarily taking over your job. It's
not in that aspect.
No. Yeah, no, it's allowing you to even do more.
Yes.
Yeah.
Yes, definitely streamlining the process, and it's making it a little bit easier on us to get through the amount of workflow that we have, because as long as these hospital systems keep getting bigger and bigger,
and they are,
and they will,
and
the lack of staffing in there, because we are always in a staffing shortage.
Always healthcare,
because they don't want to pay us. There will always be a lot of work that needs to be done. Yeah. And in order to help us get through that work, we have different processes, such as like the technology to help us do that. Yeah. Yeah. It's essential. Let me go back to this refocus where we had, the EHRs.
Okay. Yeah. So another form of technology in healthcare that is very prevalent, no matter honestly where you go, is EHRs, or electronic health records.
Oh, I speak fluent EHR.
And there's so many different kinds. There's one of the bigger ones is Epic. There's Cerner, Meditech,
Soft Lab. I don't think SunQuest is a thing anymore. They even have, there's a plethora. There's like a lot. Major ones, and then you have like your smaller mom and pop hospitals.
Yeah, or like small, like physicians clinics and things like that where they can't necessarily afford the huge systems. They just need something small.
Correct.
Yeah.
Or even like very specific like departments like blood bank sometimes has its own EHR, or like respiratory will sometimes have their own EHR to incorporate into like the bigger systems.
Oh, yeah. Okay. So they kind of all talk to each other.
Pretty much.
Gotcha.
Yeah. So you call those things like integrations because they're integrating with like all different.
Makes sense.
Yeah. It's very interesting.
Yeah.
I could talk about that all day.
It's nice because although it's technology, it's still healthcare related.
Very much.
So like it still tickles that little spot in the back of your brain.
Yeah, just a little good itch, you know?
Yeah. So I know with electronic health records, a big thing when it was first implemented was the amount of pushback.
There was a lot of pushback.
Yeah, because everything was
paper records.
Paper charts.
Yeah, paper charts, paper records, paper trails.
Rolodex.
We love those Rolodexes.
I've never actually seen one in real life.
Really?
No.
It's very impressive. Whoever came up with that system, maybe it was a person Rolodex.
Maybe
their name was Rolodex.
That's usually how it works.
Yeah, it usually is. But that was a lot of information in a little cylindrical tube. So But yeah, there was a lot of pushback moving on to electronic health records.
Yeah. And I think that was kind of the shift of technology, early.
It was about
maybe early
2000. Yeah, 2009-ish. Former President Barack Obama put into play I think it was the High Tech Act. President Obama had put into play in like 2009 the High Tech Act. Right. So that incentivized hospital systems to incorporate like electronic health records. Or else they'd actually face fines for not having them. Yeah. And so it kind of streamlined everyone to kind of get on the same page for being able to have a place centralized for patient records. Right. For medical records.
And it's funny because with all the pushback that there once was, people don't really know how to function without an EHR. If like the systems go down and you have to paper chart.
That downtime.
The things that I've heard.
It is not a fun system.
Yeah.
I remember one time like switching EHR systems. Not me being, this is a triggering moment. This is a memory that I have not thought about for a while. I remember working in, this was my first medical laboratory science job. Okay, like where I first got hired. We were moving from one EHR system to, I don't remember which one it was, but a bigger one. Okay. We were on downtime for about a week.
Oh my gosh.
Because we had to move every single file. When we went up, quote unquote, we went live, the files were not there. So every single patient had to be inputted hand by hand. I remember there were stacks of paper and we had to go in one by one.
Oh my gosh.
Yeah. That was very uncovered memory.
Wow.
Shout out to y'all. I'm not going to name y'all, but shout out to y'all.
And mind you, it's not even like that was decades ago.
No.
That was more recent.
This was literally 2017-ish.
Okay.
I think it was about 2017.
Okay. Yeah. That's not long ago at all.
It was literally yesterday.
Yeah. Precisely.
Literally yesterday. Literally yesterday.
Yeah. Okay. So to kind of build on top of that, I think the biggest thing is just not to be afraid of technology.
Right.
Because it's really there to help us. Yeah. And if anything, those things that people are fearful of, the best thing you can do with your experience is auditing. That's the first thing I think of as a certified medical coder. Yeah. When I got into the field, everybody was like, oh, medical coding is going to be out the door. The systems are going to, code the whole chart for us. And I can see why that was people's fear, but the way charts are coded and the way insurance likes to see things done, you still need humans.
Need them.
Yeah.
Necessary.
You still need us. Yeah. So just learning how to work together.
Yes.
Like,
really.
Yeah.
Working hand in hand.
Yeah.
Them helping us. We're not really helping them, but like they're helping us. Because they're already set. Like, unless we're feeding them or like training them for, whatever information whatever information it is that they're grabbing to learn
Yes.
these like systems.
Yeah.
And that would make sense.
Yeah. And you should be open-minded.
Very.
Because the technology is only advancing more and more
Every single day.
every day.
They're finding out new ways to either like help patients or to help different like healthcare workers, whether it be physicians or like anyone in surgery or any like nurses, anyone in the lab.
Yep.
Always finding ways to kind of like alleviate like the stress.
Yeah. When you say help patients, that just made me think. Imagine all the patients that are now able to look up their charts and everything online.
Yes.
Versus the influx of calls
for medical records.
Oh my god.
Medical records. I hope y'all are feeling a little bit of like heat taken off of y'all.
Yeah.
Because my chart is people can access my chart in the palm of their hands.
Yes.
Which is technically what a lot of people, if you're thinking of like health tech, that might be like your first like line of health tech specifically for like the patient.
So that's what you think of when you hear tech when it comes to healthcare.
Yeah.
Okay.
Because I'm thinking of like the interfaces of like how the patient gets their results.
Okay.
I mean, that's like my background, so that's what I think like health tech.
Makes sense. That makes a lot of sense.
Yeah. So even specifically like with the different interfaces for like the EHRs.
Yeah.
They're similar in what they do. Like they contain patient information, right? They have all of their records in there, but each of the EHRs are like a little bit different.
Yeah.
Right? On like how, first of all, how they look.
Yeah. Even within the same EHR like system, they look different. It can look different from hospital to hospital.
Very
or
much
facility to facility.
Yeah, just because of the setting that they have set up to accommodate that hospital or like facility, right? And I guess even like what they offer per each facility or each location can be different.
Yeah.
Like specifically if I'm looking at like Epic versus like Meditech, and I'm trying to, I don't know, look up a patient's a blood transfusion like records or something.
Okay.
The way I gotta get to that in Epic is completely different on how I have to get to it in Meditech.
Right.
But both of them contain the information that I'm looking for. It's just how to navigate those.
So it's like an iPhone versus a Samsung phone.
Yeah, we're doing the same thing. We just are shaped differently.
Yeah. Yeah.
Our interfaces are a little bit different.
Yeah.
But at the end of the day, I can make a call.
Exactly.
I can take a picture.
I can get on Instagram.
And I can TikTok.
And YouTube. I think a great point as well, having the clinical experience using these, technologies and systems.
All right.
If you want to pivot into like more of a tech side,
yes,
you're able to get into like the health tech side, right? So like with these EHRs specifically, is the first thing I can think of is like an analyst.
Yes.
Right?
Okay.
So an analyst, you literally can build off of the knowledge that you have working clinically.
Yes.
And be able to bring that knowledge to maybe your Epics or Cerners or MedTechs when you work for them directly.
Very
true. So you can actually give them your perspective as a clinician using that system.
And they prefer people who have backgrounds in clinical areas to help them with those EHRs as like an analyst. Like specifically for me, like having that lab background and then going to be like an integration analyst for lab interfaces. They're like, oh, we don't have to like teach you 75% of the stuff.
Literally. It's so much easier to teach a clinician the tech side than it is to teach someone on the tech side the clinical side. Yes. So much easier.
So much easier because it's like we said, like a whole other language.
Yeah.
A whole different language.
Anything medical, healthcare related, different language.
Completely different language.
Yeah. I think my most favorite form of technology in healthcare though, and I might be a little biased because I work in surgery.
Of course.
But all of the different equipment that we use in surgery, I love cardiac surgery, and there's so many different, literally equipment, machines, mechanisms that we use to essentially assist us in making sure that the procedure goes very well, and we have less risk or opportunity to have to bring the patient back. So like one thing, not specifically.
That's okay. One thing's okay.
So like one thing, I'm gonna do it again. I play too much because I say specifically on purpose all the time. So one thing specifically that I can think of is when you're doing a coronary artery bypass graft, which is essentially when people have heart attacks. It's because there's a blockage in your artery that sits along your heart.
Okay.
So when there's that blockage, we'll have to take a graft or a different structure to basically reroute the blood to your heart. Right?
Okay. That's fair.
So before we finish the procedure and close your chest up, there's a machine called a Medistem that it literally checks the flow through that new new pathway.
Nice.
Yes. So we're
That's
able
cool.
to check to make sure that you're getting good flow through that new artery without finding out the hard way.
Right.
So you know before you leave the OR that it's a good flow through that through that new pathway. Yeah. Things like that I love about technology and healthcare. Yeah.
Love that.
Yeah.
This makes me all take, because it's like, who even thought like, you know what we should do?
Right.
Let's make a device that'll allow us to test the blood flow of this new pathway that we've just set on this patient.
Right. Because the last thing you want to do, especially in open heart surgery, is to have a redo chest, is what we call it. When it's somebody that's already had a sternotomy and you have to take those sternal wires out and open up again.
Yeah, you don't want that.
Yeah.
You don't want it the first time, but you
right.
you had to get it, but now you don't want it again.
Yeah. So technologies like that is a beautiful thing.
Of course.
You know?
Of course.
Yeah. You know what makes me very excited? Because I feel like people sleep on health tech.
They do.
I love that Afrotech this year, 2025, is actually implementing more health tech in their lineup. Super excited about that.
Thank you for that.
Yes.
Thank you for that.
Because I definitely wanted to be more involved last year because it was in Houston last year. It's going to be in Houston again this year. It's very close to me. Like I can literally walk to where the conference is.
Very close.
And I didn't feel like I could get much out of it from, my career. But there were a few like little pop-up mixers outside of the actual conference.
Correct.
That was really nice. It was really good to be able to connect with people, which is actually how we met.
Oh yeah. Now we're forgetting that's exactly how we met.
We met at a STEM social. Which is the science, technology, engineering, mathematics.
Yes.
So we got the technology in there and the science in there. And we met at that event during Afrotech weekend or week. Yeah. And if it wasn't for that, I don't think there's very many healthcare related things going on. I went to one other event.
There was another event
that was pretty, those were the two big ones. It was STEM social, and then there was I want to say it was called Health Tech.
It was called. It was blue and not blue, black and yellow font or something. Yes. Yeah. I agree.
But otherwise, that was really it. So it's exciting to see that
they implemented this.
Yes.
Yeah, because I specifically went to the conference.
Okay.
Yeah, and when I was going through the workshops and going to the expo area to see kind of what was happening for health tech, there really wasn't that many different sponsors or even different workshops. There was maybe, I want to say there was less than 5 workshops. It was a really interesting one put on by HHS talking about EHRs and my chart and people being able to access their charts, specifically on the high tech act that Obama had passed. But, like you're saying, there weren't that many outside health tech events, and I was kind of it's a little interesting, because health tech is tech. Yeah,
and then to be in Houston, which
the
has the largest medical center in the world.
And you're not representing health. It's kind of it's kind of a miss. But I'm glad that they've heard and they've now made implementations to accommodate for more health tech.
Yes, I love organizations that listen to the very people that build them up, and
I agree.
Super excited.
Very excited.
We're gonna have to at least go to some of the events.
Go and see what's going on.
Yeah.
Afrotech, let's see.
Yeah, Afrotech 2025?
Yeah.
Huh?
Are we?
What?
Foreshadowing? Maybe.
Huh?
We'll see.
Yes.
So stay tuned.
Yes, stay tuned. If you have any questions, healthcare, technology related, please drop them below.
Yes.
This is a topic that I feel like we need to discuss more. So I know y'all have comments.
Yeah.
Y'all have questions.
Questions, comments, queries, all
Yes.
of that. Please put them down in the comments below.
Yes. Like this video.
Share this video.
Subscribe. Oh, yes. Share this video.
Please share this video so we can get people talking about health tech.
Definitely. Hit the notification bell.
Yes.
So that way you're notified the next time we post a video.
Mm-hmm.
Tell a friend to tell a friend
To tell a friend.
To tell a friend.
And make sure that friend tells that friend.
Yes.
Mm-hmm.
And tell your mama.
Yeah. And your daddy.
Yeah.
And your aunties.
And your granny.
And
Your sister. Your
uncles,
brothers.
if
Cousins.
They want to listen.
Yeah.
The neighbor.
Yeah.
The dog.
It's only about the pets. They're family
They're
too.
family too. Yeah.
Yeah.
And until next time.
Yes. Mind your health.
Bye.
The end of our videos are always so chaotic.
Chaotic.